stupid questions and don't ask
So-
any questions.
So I know you've already met me, but
Let her get it over with so that she can turn the thing off and then we can ask her questions.
okay. So my name is Donna Graham, and I'm a clinical educator here at NAP, but I'm also getting my master's degree in nursing education, and I'm doing my clinical hours here too.
Awesome.
So part of my requirement is I have to teach for an hour, but I also had to develop the curriculum, plan it out, engage you guys. So I hope I'm already interested. So let me tell you just a little bit about myself. I'll go into more detail. So I've been a nurse for 26 years. I graduated in Canada with a diploma RN, which I don't know if you've heard of a diploma. And then I came down here fresh out of college, naive and green, to stay for a year, and here I am 26 years later. I got my bachelor's degree about 5 years after I came. Once I was a resident and could pay in-state tuition. And now I decided to go back for my master's in education. Just so happens a position opened up in October, and so I'm very, very new at educating. I'm not new at nursing, but I am new in different areas of nursing because I've only worked med-surg, tele, and women's services. So I know that there's those of you that have way more experience in some areas and not in others, and I think it's really important that we always work as a team, right? And so the first thing I wanted to do is give you guys a little test on what I'm going to lecture on, and then we'll go over the test. I don't want you to put your name on the test. It's totally anonymous, okay? And you guys may have heard of these things before, and you may not. And I just want to see how you do blindly, and then I'll collect them and I'll analyze them later, if that's okay. Make sure it's recording me, and it is. Just me, nothing. Totally anonymous. It's really evaluating how well I write test questions. Test your knowledge and test my skill as well at the same time.
Did you take the NCLEX in Canada or here?
I took it both. I took it in Canada, and then I didn't know if I had to take it in the States or not. And a busload of my classmates were going to the States to go take it again. just
So
in
you still
case.
took it on paper too?
Yes.
Yeah, we were the last group to take it on paper in '93.
Yeah, I took it at the beginning of '92, probably in '92 and then '93.
Okay, so you took the winter version because it was only given twice a year. So I took the summer, the July of '93,
Oh, okay.
So-
Yeah, I took it like in January or
Right.
something. Yeah.
because it was only given every 6 months back then. And ours took even longer to get the results because they were also trialing the computer test. So there was a select few that got, they had to do computer questions. And then they were comparing results. So we didn't get ours until, like, we took it in July and we didn't get it till the end of October, beginning of November.
And I found out after I took it that depending on your score in the Canadian one.
You didn't have to take
Yeah,
it.
so I didn't have to. Because luckily we took it all real fresh, you know what I mean? We didn't wait very long because we didn't want to forget. You don't use it, you don't use it. Remember, you're not getting graded on the test, and I'm not gonna know who you are. No pressure.
You should have.
Thank you.
You should throw in select also.
So the test is also a grade for me, because I'm gonna get graded on how well I can write test questions, and afterwards I have to analyze, like, the scores, and see whether or not I should have maybe thrown out a test question or worded it differently, depending on how you all did as a group. And then, I know you guys have different levels of experience and education, so that's gonna be interesting to see how different people answered it, right? And help me to write them better next time. So the topic that I was asked to speak on are the 2019 National Hospital Patient Safety Goals, with a focus on identification and staff communication. And there's a whole bunch of little objectives in here. I don't know if you want me to go through all of them, it would probably take a long time, maybe I'll just kind of synopsis. So the goals I'm gonna go through, there's 7 of them. And you wanna explain, be able to explain when we're done, why they're important in providing safe healthcare. Explain what the goal identify safety risks in inherent populations means. Discuss clinical alarms. Recall healthcare associated infections. Explain 2 ways in which we can improve patient safety when giving medication. Understand why it's so important to identify our patients correctly. Analyze assessment data and determine priorities, because we always use the nursing process every day. Discuss bedside report, and state the benefits to both the patient and the healthcare professional when we give bedside report. And then talk a little bit about bedside report challenges, the challenges that I've heard come up. The other one is to recall SBAR and understand what that means when giving a report. And I'm also going to give you a little evaluation tool that you can fill out and let me know how I did today, okay? This morning. And you are allowed to ask questions, Susan.
Just joking.
So I wanted to relate this to Knapp Medical Center because that's where I'm giving the presentation. And again, I'm going to review the mission. Knapp Medical Center's mission is to deliver compassionate quality care to our patients and better health care to the community. The vision is to stay consistently forefront in resolving healthcare reform, to be current and consistent, aware of our patients' needs, and to give high quality, affordable care. So our values are quality, compassion, community, and we have a board that is physician-led, so they have input, of course, into our decisions. Now, the Texas Board of Nurses, anytime they approve a program, they want the teachers to teach in regards to the differentiated essential competencies. These are the minimum competencies required for any program in nursing, whether it be LVN, RN, and it's on their website. And the goal of these programs, or any educational program, even in the hospital, should be that we're facilitating our nurses to be member of the healthcare profession, providers of patient-centered care, safety advocates, and members of a healthcare team. And Jean Watson was one nurse that made the theory of human caring, and she decided that nursing really involves a lot of empathy and warmth, and her focus was on safety, comfort, and privacy. And she also felt that you needed to do that in a particular order. First, the patient needs, of course, to feel safe, and then depending on the situation, you may have to prioritize differently, right? Of course, there's a lot of nursing theories out there, and this is more in-depth than that, but I just kind of wanted to give a synopsis of it. Now, the Institute of Medicine, so from a doctor's perspective, they say that the 6 aims of healthcare right now are to be safe, effective, patient-centered, timely, efficient, and equitable. So you see how our mission and the T-Bond and Institute of Medicine all align, right? It's kind of interesting. And now the biggest thing lately has been to include evidence-based care. So we want our care to be of high quality, safe, and if we use evidence-based, it shows that it does this, and it also improves our outcomes and reduces costs. Evidence-based care also has been shown in studies to increase engagement, teamwork, and satisfaction of healthcare employees. And then that's the first question that I gave you guys. So evidence-based practice is defined as, and what did you guys put? What did Susan put?
3.
Number 3, a problem-solving approach that integrates best current evidence with clinical practice. Did you guys agree? Yes, right? That's correct. That was easy. Now, the 2019 hospital patient safety goals are identify correctly, improve effective communication, improve medication safety, reduce clinical alarm system harm, prevent infection, identify safety risks, and prevent surgical mistakes. There's a reason why this is super, super important, and I'm going to play like a little clip so you can kind of get a perspective from a consumer point of view.
Dennis, let me start off. How are the twins doing now? I mean, did they suffer any long-term consequences?
No, thank God they didn't. Twins are doing great, and in fact, they're probably ahead. Of course, I'm a proud parent, so they're probably ahead in their development, really, and we just couldn't be happier.
And Dennis, take us back to that day when you got the news. I mean, what went through your mind?
Well, it was the most difficult day of mine and my wife Kimberly's life, really. Our twins were given 1,000 times the dose they should have received of a blood thinner, heparin, and were bleeding out of every place they'd been poked or prodded, and there was a real danger of them hemorrhaging through a vein or artery and causing brain damage or damage to a vital organ.
And I mean, so what did the doctor first say to you? I mean, how did they break that news?
Well, they took us into a room and told us what had happened, and also told us that this same incident had occurred in a hospital in Indianapolis just a year before that had killed 3 children and injured several others. And from there, it was a 41-hour event that luckily ended with the twins surviving.
And Dr. Gentleman, I mean, how often does this happen? How often do medical mistakes occur? How big a problem is it really?
It's a staggering problem. We have the equivalent now of about 20 747s going down every week in America. If you add infections, which are 100,000 preventable deaths, and most of those are preventable, to the former number of 100,000, that's 20 747s going down. But it's spread over 5,700 hospitals.
It comes out to about 200,000 people a year who are dying needlessly, preventable.
You say that zero harm is the goal, but I mean, humans make mistakes. Is it really possible to have a day when no patient is harmed?
Well, that's what we're after. And of course, human error is always going to occur, but we can get that number as close to zero as possible. We compare the aviation industry to the medical industry. Really, we would like to see an NTSB-like organization in healthcare that investigates accidents as they occur and can go to find the problem